Hello, my name is Amber Clough and I'm the myPlan Program Director. I'd like to welcome you to this presentation about the myPlan app, a tech solution to expand access to safety planning and support for relationship abuse survivors. Today I'm going to talk through the background on how myPlan was developed. I'll walk through the app's features and discuss safety considerations, and also talk through how myPlan could be integrated into your existing services for survivors or resources that you provide. We know safety planning is the cornerstone of domestic violence intervention. DV survivors consistently report that accessing safety planning services from trained advocates and providers was the most effective thing they did to reduce violence. But most survivors never get these services. Well over 90% of people experiencing abuse from a partner don't receive formal services. There are many well-documented barriers to seeking services that people in the DV field know very well. This is where tech solutions could bridge this gap. Our DV advocacy community in general has been historically hesitant about the use of tech with survivors, and understandably, as it does present risk. The misuse of technology by abusive people to perpetrate violence, monitor, and stalk is a huge concern. In the old days of safety planning, we basically told survivors to avoid using technology, but this isn't realistic for most people anymore. We all know we live increasingly digital lives. The upward trend of digital health, behavioral health, and other tech-enabled interventions was already well on its way prior to COVID. But we've all seen COVID's impact on the uptake of telehealth and tech-based tools in general becoming an even more essential component of service delivery. This brings us to myPlan, an app to support safety decisions for people experiencing abuse in their intimate relationship. It's available for download on iOS and Android devices, as well as through a web browser. It's currently available in English and Spanish, and it's free. I'll talk a little bit about how myPlan came about and how it was developed. myPlan was developed through many years of research led by Dr. Nancy Glass at the Johns Hopkins University School of Nursing in collaboration with survivors and advocates. It's based on the science of decision-making. Basically, this all started when Dr. Glass met a decision-making scientist who worked on decision aids in healthcare settings. Decision aids are tools to help people make difficult treatment decisions. They can be on paper or digital, but they're designed to help people walk through the information on their various options, the risks and benefits of those options, and to think through their personal situation and priorities before making a decision. For example, if I have breast cancer and I'm trying to choose the right treatment for me, I'll be juggling different factors than you might be. For example, if I have kids or I don't have health insurance, these will impact my decisions. So Dr. Glass said, you know who's making really difficult decisions with many unclear options, risks and benefits to all those options, and unique factors based on each situation are people experiencing domestic violence. Maybe a decision aid model could work for DV. This is why our logo is a leaf. The leaf veins representing many different paths with different decisions to make, no path more right or more important than the other. We started work on what would become myPlan in 2006. This was before the iPhone existed, if you can even imagine there was such a time. It's cliche now to say there's an app for that, but we didn't develop an app. It actually started as a computer module. What we did is we developed an evidence-based intervention, and we continue to evolve how that intervention is delivered using the mode of technology most used, which right now is mobile devices. In addition to working with survivors and advocates to design the app, myPlan has been effectiveness tested in 2 research trials. We compared many hundreds of people experiencing DV who used myPlan to those who used a static online safety plan, the kind that you can find on most DV agency websites. We followed these survivors over a year and compared the 2 groups, and myPlan had very promising results. I'll go through just a couple of those here. People who used myPlan had less decisional conflict than those who didn't, meaning they were able to move forward in making safety decisions more easily. People who used myPlan tried more safety strategies that were helpful in stopping or coping with the abuse. More women left their abusive partner safely, and importantly in young people, myPlan users had reduced suicidality. Anybody who wants to dig deeper into the science and the other outcomes, we have our publications listed on our website at myplanapp.org. Now we'll move on to talking about some of the safety considerations when using myPlan. So we know that people misuse technology to perpetrate abuse and that the use of tech presents risk to survivors. So let's talk a bit about how we have mitigated those risks the best that we can. Safety considerations start before using myPlan. We provide information on our website and in the app stores about the risk of using, as it is very common for abusive partners to monitor your device activity. And we let users know that the safest way to use myPlan is on a device that their partner does not have access to. We also provide links to tech safety planning info on the myPlan website. We also offer choices for how to access the app most safely, either via a downloadable mobile app or to use on a web browser. We know survivors are very creative about navigating their tech safety every day, and that some are able to use a computer maybe at their work or a family member's house, but could never download something onto their phone, or vice versa. So offering a choice of how to access is an important safety feature. Additionally, users stay anonymous. We don't require any account setup, no emails, no names, no identifying information is collected. And of course, no data is ever shared. We'll go through some of the key built-in safety features. So the first is a PIN code. Users set their own PIN code to protect the contents of the app. They're also given a dummy code. So just in case anyone is ever forced to log in, they can enter this dummy code that takes them to safe mode. So this is just generic information and hides the contents of the app. There's also a quick exit button on every page in the bottom right hand of the screen, and if users press the quick escape button, they'll be taken to the safe mode page. Another really cool safety feature is that users can change the home screen icon. So they can go into the settings of the app and change the look of the icon that appears on their device's home screen. It makes it a little bit harder to trace back to being the myPlan app about relationship abuse. Unfortunately, app stores will not allow any apps to change their name on the home screen, but there are a lot of apps with the myPlan name, making it a bit more difficult to discover the purpose of it. And lastly, there's the feature where myPlan works a little bit like a bank app in that when you have multiple tabs open on an Apple device, the myPlan content is hidden. So here you can see my email, the weather app, but the myPlan screen is blank. We can never eliminate all risk, but we have worked very closely with advocate survivors and our developers to implement as many protections as possible. Next, I'll walk you through myPlan's features. I'm going to go through them on the screen, but if you like, you can follow along on your own device. Scan the QR code on the screen now, which will take you to the download links for your Apple or Android device, or the link for the web app, which you can use on a browser. If you can't scan this code, go to myplanapp.org for the links. After some brief intro info about the app, users are then asked to set a PIN code to keep myPlan private. Users are also immediately given info about the risk of devices being monitored by a controlling partner, and then given the dummy code that we talked about earlier if they're ever forced to log in. Then the first question that users are asked is if they're coming to the app for themselves or for a loved one. myPlan is also for friends and family to get information on how to support a loved one experiencing abuse, but we're going to go through the pathway for survivors first. At the top of the homepage is a feelings tracker. Throughout our testing and getting feedback from survivors, we got many requests for having the app ask how you're doing and to deliver something like inspirational or motivational quotes. So we added this little emoji feelings check-in that delivers quotes based on the emoji that you choose. What makes myPlan different from safety planning info you find online is that the myPlan info that's delivered is personalized to the user. Online safety plans are static. It's the laundry list of safety planning strategies designed to cover all situations. If you're staying, if you're leaving, if you have kids, if you don't, if you're in college. The questions you answer in myPlan will personalize the info more to the user so they don't have to sift through information that's not relevant to their situation. So the first set of questions that is asked is called the basics. Questions like, is this your current partner or an ex? Are you a college student? What's your partner's gender? Do you have kids? And other items all used to tailor the rest of the information in myPlan to the user. For example, if you don't have kids, you won't get safety planning and resource info for children. If you tell myPlan your partner uses she, her pronouns, the rest of the app will refer to your partner as she. myPlan has 4 main sections. You can always get to them by selecting the menu button in the top left-hand corner. The sections are My Relationship, My Strategies, My Resources, and My Learning. And we're going to start with My Relationship. After the basics, users can choose to go through a variety of assessments in the My Relationship section. The assessments do 2 things. First, they give insight to the user on their specific relationship. And second, the answers to the questions personalize the information delivered in the other sections. Let's take a look at the red flags assessment for example. This assessment is designed for the user to learn more about if the red flags that they're seeing are indeed a sign of abuse. The assessment walks the user through types of abuse with example behaviors, asking what red flag behaviors they are seeing from their partner or ex. At the end, the user will get messaging based on their answers. One thing to note again about personalization. If the users had said in the basics that they identified as LGBTQ or an immigrant or have a disability, for example, this red flags assessment would include examples of using LGBTQ identity or immigration status or withholding assistive devices as an abuse tactic. But if the user hadn't selected those things in the basics, then they wouldn't get those as possible abuse tactics. The personalization is layered throughout the app. One of the assessments in the My Relationship section is the danger assessment. Some of you might be familiar with it and use it in your work with safety planning with survivors. It's a risk assessment developed by Dr. Jackie Campbell at Johns Hopkins University, and it's used nationally to assess for risk of homicide in cases of domestic violence. For myPlan users, they go through the danger assessment and they're asked a series of questions, and each question is a risk factor for serious violence. Research shows that the more risk factors that are present, the more risk a survivor is in for serious violence and possibly death. The user is then given information after they answer the questions about the level of danger that they may be in from their partner. So we know from our work with survivors that many already know that their partner is dangerous. And going through this assessment is extremely validating to get the information at the end that says, yes, your partner is indeed dangerous. But we also know for some that this can be difficult and scary information to take in. And the app really encourages users to reach out to a DV advocate to talk through when they are finished with this assessment. Another activity is a priority setting exercise. This is also a heavily researched model for assisting people with difficult decision making. So we know that survivors are juggling many competing priorities when they're navigating an abusive partner. Those priorities might be things like their safety versus their feelings for their partner versus their children's safety, and so on. So in this exercise, users will rank these different factors side by side, and this can be extremely helpful for people to decide what to do next about their relationship and their safety. All right, so we've gone through a number of the assessments, and now we'll switch over to talking about the My Strategies section. So users can choose to explore a selection of categories for safety and well-being, each with their own set of strategies. There are a number of static strategies, meaning that every user gets those strategies, and then a number that are delivered based on the user input, based on the questions that they answer. So you'll see at the top of the section, there's also messaging on how personalized the strategies are to each user. So the more assessments they take, the more personalized the strategies become. Some strategies include links or videos for more in-depth information. For example, in the Plan for My Safety category, there's a strategy for developing a code to alert others that you are not safe. It includes a video of a possible signal to use, which we won't watch the whole thing, but we'll just give you an example here.
It's nice to see you again.
Yeah, great to catch up.
Yeah. Oh, can you share that banana bread recipe?
Oh, sure. It's actually my mom's banana bread recipe, but it's pretty foolproof and it's super easy.
Oh, well, I appreciate it. I know your mom is a great baker.
Next is the My Resources section, which contains links to a selection of national resources, mostly hotlines or national directories. These resources are also tailored to user input. For example, adding resources specific to cultural and contextual factors for the specific user, like Strong Hearts Native Helpline or the Trans Lifeline. We also have a partnership with the National Domestic Violence Hotline to connect to their resource directory. Users can choose resources near me and enter the zip code for the area that they would like to search, and they'll receive a list of the DV organizations in their local area, in addition to the national resources that we provide. And last is the My Learning section, a collection of informational activities for learning more about the dynamics of healthy and abusive relationships. For example, there are definitions of abuse, a factor myth quiz, and a consent frequently asked questions. myPlan is not just for people who are experiencing abuse themselves, but it's also a tool for friends and family members who are concerned about a loved one who might be in an abusive relationship. So in the beginning, the first question that you're asked is what relationship you're coming to the app for, and if you select a friend or family members, then that will take you to the friends and family version of the app. Here you'll be asked a set of questions about your situation, again, to personalize the app for your loved one, and the strategies are really focused on how to best support that person. Things like how to be an active listener, making sure you're using validating language, and also how to take care of yourself, as supporting someone who is in an abusive relationship is really hard. One last bit about some additional options in the menu. So you are able to bookmark strategies and resources if you want to save a specific list for later. And in the menu, you'll see a button for My Bookmarks, and that's where you would access those. There's also a My Settings button, and there you'll be able to do a variety of changes, like change the app from light to dark mode. You're able to change the colors, able to change the language, things like that. There's also a DV Hotline chat button where you can connect directly with the National Domestic Violence Hotline by chat, and also a button to delete all of your info and to start over. One important note, I want to acknowledge that myPlan is not meant as a replacement for the expertise of providers or advocates. An app can never replace your real-life expertise. It's designed to encourage the majority of survivors who never seek services to reach out for help. It's also not the magic bullet. It's one tool that won't be accessible or safe or right for everyone, but it is one option. So now I want to talk about how you can use myPlan in your work with survivors if it's a resource that would be useful for you. In some settings, advocates and providers may have very limited time with a survivor and may not have the ability to do individualized safety planning. This is an area that you could suggest myPlan to clients for them to use if and when it's convenient and safe. You could also put flyers in waiting areas or places to reach survivors privately, like restrooms. You could add myPlan to your resource list or website, similar to where you list the National DV Hotline as a resource. Or if your organization has devices available for client use, you could download or bookmark myPlan and direct clients to it. Another option is suggesting it to your community partners who may encounter survivors, but who aren't as trained on how to safety plan. Maybe healthcare providers, law enforcement, or school personnel that you work with. myPlan was created for survivors who don't have the support of a trained DV advocate. However, we have heard from many advocates across the country who are using myPlan in their work with clients. They're using it to help facilitate a discussion about their level of danger and their priorities when making difficult safety decisions, or using myPlan as a training tool for new advocates or staff. Some of the benefits to using myPlan that we've had advocates talk to us about is that it uses the danger assessment, which is commonly used in domestic violence organizations, but it's done on paper and scored by hand. myPlan includes the danger assessment digitally, and it automatically provides the risk score in real time. Clients can also review content 24/7. They can change the information in myPlan as their situation evolves, and they can continue to use myPlan even after they discontinue services. If myPlan would be a helpful addition to your resources, we have an online toolkit on our website. On myplanapp.org, there are toolkits that contain shareable resources to integrate myPlan into your services if and where that makes sense. For example, there's flyers, presentation slides, email templates, ready-made social media posts, things to make it easy for you to get the word out about myPlan in your setting. In addition to our research showing myPlan's impact, we receive messages regularly from myPlan users about how it supported their safety and well-being. Here's just a few examples here. Anybody who works with survivors know that this work is incredibly hard to do and hard to keep going sometimes, but these are the kinds of messages that remind us that the work we do is incredibly important. Thank you for everything that you do to support survivors. Visit our website at myplanapp.org and follow us on social media. And if you have any questions, contact us at info@myplanapp.org.